weather. Sun's going to be out. It's going to be warm. So enjoy your next presentation, infection control. If you could do the best you can to give your attention to each presenter. They're all volunteering their time and doing the best they can to help us together work towards refreshing ourselves on some important things we need to know. So please give them the best attention you can, cooperate, participate when called upon, and enjoy.
Great, lots of quizzes today. No, all right. Infection prevention, it's your job too. My name's Caldwell Lewin. I'm the infection preventionist and employee health coordinator here at the hospital. What that means in a nutshell, I'm in charge of infection, anything related to infection. I do surveillance of any infectious concerns, track potential outbreaks or cases that raise red flags. I also do development and implementation of the infection control policies here in the hospital. The employee health piece of it kind of ties into that. That's your annual PPD, which is now TST screening for tuberculosis. That's all your titers that have to be done. If you have a sharps needle stick injury or exposure here at the hospital, you will get to see me. So the objectives of this course, we're going to discuss the infectious disease process, the chain of infection. We're going to touch upon standard precautions, the importance of proper hand hygiene. We're going to talk about ways to break the chain of infection, proper techniques, and infection prevention. It's everyone's responsibility. So the chain of infection, what I'm hoping you'll get from this is just a better understanding of the cycle of infection and be able to recognize opportunities where you as an employee can break that chain. So the chain of infection starts with an organism, which then goes on through a reservoir, portal of exit, transmission, portal of entry, to a vulnerable host. So infectious agents, these are bacteria like staph, Klebsiella. The mycobacterium, the big one, tuberculosis, viruses, HIV, influenza. There's fungi, yeast, molds, parasites, scabies, head lice, and then prions, which are abnormal pathogenic agents that cause neurodegenerative disorders. A big one would be mad cow. Reservoirs. This is the habitat where the infectious agent lives, multiplies, and grows. So it can be human, which is all of us, animals, or the environment. The portal of exit is how the organism leaves your body. This can be done through the respiratory tract, the intestinal tract, the genitourinary system, skin, open wounds, and blood and body fluid. The next one is the transmission, which can be done contact, airborne, common vehicle, or vector-borne. So modes of transmission are direct, which is the person-to-person touch. We do that every day. We're constantly interacting with people, touching people. Then there's the indirect, the intermediate contaminated objects, computer keyboards, telephones, iPhones, desktops, pencils, pens, you name it. Pretty much anything in a patient's room. And then there's the droplet. So the contact droplet is the short distance. That's when you're sitting there having a conversation with someone and spit's just coming out all over you and you're breathing it in. The other one's the airborne, and these are, you don't see these kind of float all around. This is how chickenpox is transmitted, this is how tuberculosis is transmitted. These are scary ones. Another mode of transmission is a common vehicle. These are either active direct transmission, which is where the organism replicates in the vehicle and gets bigger and bigger, or passive, which the organ's not replicating, but it's still passing on to someone else. So you see this in food, water, the fecal-oral route, and then contaminated products. You can get contaminated blood products or contaminated medications. The portal of entry is how it enters your body. I like to think of the T-zone, your eyes, your nose, your mouth. But it can, again, go through your respiratory tract. You can eat something that has an organism on it, go through your genitourinary tract, and then the skin, open wounds, and the blood and body fluid. So your susceptible host, just like Julie, your cruise director, a person who gets the infection because he or she is unable to fight that infection. They're in a weakened state. That's our patients here oftentimes. They're also the under-immunized, younger children, or the immunocompromised. So standard precaution, these are the rules of engagement in the war against germs. These are things that we should be doing every day in our daily practice here at the hospital. So what are some standard precautions? You guys can shout them out. Hand washing. What else? Gloves. Anyone think of anything else? Face mask, your PPE. So these are routine practices meant to reduce the risk of transmission of bloodborne and other pathogens from both recognized and unrecognized hosts. These pathogens are everywhere. We're constantly coming into contact with them. This is the basic level of infection control process. We have to do it for all patients. It's required. So these standard precautions, it's hand washing, it's your personal protective equipment, gloves, gowns, eye protection, mask. Use the appropriate equipment for what task you're going to be doing. It's also our safe use of sharps, the disposal of them and the use of them. It's our environmental cleaning. It's cleaning the shared patient objects, cleaning the wheelchairs between use, or the IV poles, or the tray top tables. It's the respiratory hygiene and cough etiquette that we want everyone to adhere to, even our visitors. Aseptic technique, and it's waste and soiled linen safely and properly. Don't throw it on the hospital floor and roll it up and put it under your arm. So the chain of infection, again, you have your infectious agent, your reservoir, your portal of exit, your vehicle, the means of transmission, your entry, and your susceptible host. At every point in this, hand washing is the number one thing you can do to break the chain. Always, every time. So we're going to move on. I have a quick little movie to show you.
So we never learned his lesson. He finds himself invincible, but I am invisible. The evil that will make his arrogance so pitiful. He was confident as he pledged his allegiance to heal this young boy as he lay steady breathing. Seizing the moment, I crawled out my carrier. Never cared to be careful, so we left no barrier. He smiled, shook hands as I started to slither. Signature on the sentence of death he just delivered. They will all witness when he struggles to breathe. Because I am the sickness, I am the disease. The breeze that blows, ring the bell for the moment. The coming of the reaper for the patient he had chosen. So smile all you want as I commit my violence. Once I've done my duty, moment of silence. understand what's happening. It's all unraveling. I see the future, the past, and my mind is time traveling. Slow motion as I stand, leaning over at his bedside, knowing he'll be worse when I am seeing him the next night. His life slips in the steady drip of the IV. Blanket stand from tears every time his mom sees her son that comprises all her hopes and aspirations. So her life is slipping too as he is slowly fading. Taking time to envision the procedure in mind, looking for the cause and just hoping to find it in time. See, he came to me for healing, but he's only getting sicker. He came to me for life, but now he dies quicker. And now I'm getting sicker as I start to reflect, realizing maybe it was all because of neglect. Next minute he's crashing with his blood in my hands, and I'm wondering if the villain is standing where I stand. Wondering why his son is suffering. The doctor cries deep as I stare into his eyes. Now he knows his arrogance is why I had to die. Hands meant for good but transformed into killers, meant to heal my body but slaughtered the gun quicker. And when the shots fired, they were deadly but silent, with an unknown accomplice that carried out the violence. Lay there quickly dying as he's trying to revive me. Brother cries like he's never cried right there beside me. My grip on life is slipping as for the last time. I think of things I'd see if I had time. I came to you for healing, you just made me sicker. I came to you for life, but you just made me die quicker. My family, the blood, and your eyes paint the picture. The last I'll ever see as the lights get dimmer and dimmer and dimmer.
That was deep, yo.
Alright. So, a little bit serious, I mean, kind of a fun edge, but the reality is it's in all of our hands. We have the power and the control to really make a difference for our patients, for each other. So hand hygiene, who, what, when, where, why, how. What is hand hygiene? It means cleaning your hands. You can do this using soap and water, antiseptic hand wash, antiseptic hand rub, the alcohol-based hand sanitizers, the foams and the gels that are scattered throughout the hospital, or the surgical hand antisepsis. Why is it important? So infections they're our business a little bit, but they're a big problem in healthcare facilities. So every year, over 2 million people often get hospital-related infections. Oftentimes, these are transmitted on caregivers' hands between patients. So cleaning your hands breaks the chain of infection, and it protects the workers and the patients. So bottom line, get them clean. Hands are the most common vehicle of transmission of organisms. It's been recognized as the single most important way to prevent the transmission of infection. So there's two methods for hand hygiene. The alcohol-based hand sanitizers. These are the most effective products for reducing the number of germs on your hands. When your hands are not visibly dirty or soiled, it's the preferred method. The antiseptic soaps are the next most effective. Non-antimicrobial soaps are the least effective. Obviously, you're going to use soap and water for visibly dirty hands. Again, I'm going to say it. Alcohol-based hand rubs are the most effective way for killing germs, and they're more effective than soap and water. So it's going to kill those germs. It requires less time. If you're using hand sanitizers, that's 20 to 30 seconds. You can dance, you can walk, you can go on and start thinking about your next task. If you're washing your hands with soap and water, you're 40 to 60 seconds and you're stuck right in front of that sink. So it's more accessible. It produces reduced bacterial counts on hands. And it actually improves the condition of your skin and creates less drying. So during routine patient care, you're gonna have to wash with soap and water if your hands are visibly dirty. If you're playing in the dirt, wash your hands. If you've been exposed or you think you're exposed to C. difficile, norovirus, diarrhea, before you're eating and after using the restroom. If you think about it, if it's brown, you're gonna wash it down. Otherwise, you're gonna use the hand sanitizer. So do you use hand hygiene when you should? I will say, I would love to tell you I'm at 100%. I'm probably not. I would be pretty comfortable in saying most of us in here are not at 100%. And it's an interesting thing. Providers, especially nurses or staff that are in the direct patient care setting, in a 12-hour shift, you should be washing your hands close to 100 times a shift. It's a lot of opportunities or potential missed opportunities if you think about it. So when I did a survey monkey, probably the second month I was here, just kind of trying to get a feel for why people weren't washing your hands. These were the reasons. People selected this over 60% of the time. So my hands will get too dry. No, they're not going to, and there are approved lotions and everything that you can use to put on them. I wore gloves. I know. If you're wearing gloves, you absolutely need to wash your hands afterwards. Gloves are not a 100% protective barrier. They really do help, but they're not perfect. I don't want to remind my coworkers. We need to be supportive of each other. That's part of doing our job for our patients and for each other and building each other up. If you don't see me washing my hands, if I pick my nose and then keep on doing what I'm doing, please stop me. Remind me to wash my hands. That's not offensive. It's patient safety. And it's safety for yourself too. It's very important. I forgot, I was distracted. This one's a little bit harder because I know we all have a lot of things we're juggling in the air. We're going on to different things. It needs to become habit forming. I do know we will probably be putting in more hand sanitizers throughout rooms, and just to instigate that reminder and that opportunity that you need to clean your hands. The task related to the patient contact requires frequent in and outs. This one's a tough one. You know, you go in there, you come back out, you go in there, you come back out, and all of a sudden you wash your hands 20 times. You're like, they have to be plenty clean. It doesn't matter. You need to do it every time. So, going even further outside of patients' rooms, the filthiest public surfaces. So gas pump handles. 71% of gas pump handles are dirty enough to transmit illness. I can tell you, before I put this together, I was not getting in my car after pumping my gas and washing my hands or hand sanitizing. Mailbox handles. Escalator rails, which are not an issue in Sitka. ATM buttons. You don't know what that person that was getting money out before you was doing with their hands. Parking meters, and then vending machine buttons. Those are another ones. My kids go get candy, and then what are you doing? You're ripping it open and eating it right away. I'm not sure anyone ever cleans those buttons. So your 5 moments of hand hygiene. These should constantly be in your head. These are all the opportunities and times when you need to practice hand hygiene. Before touching a patient, before you're going to do a clean or aseptic procedure, after any blood, body, fluid exposure, which is kind of a given. If you have pee on your hands, you're probably not going to go on to the next task without washing them. After touching a patient, or touching a coworker, touching anyone, wash your hands. And then the big one that gets missed most of the time is just touching the surroundings, the patient's surroundings. If you're going in the patient's room and moving stuff around or taking them something, but you're not actually touching the patient, you still need to wash your hands when you're leaving the room and going on to your next task. But I didn't touch the patient. Why should I practice hand hygiene? So all these little bugs and microbes, they're on everything all the time. They can live for a long time. So they're on surfaces everywhere, bed rails, IV poles, wheelchairs, computer keyboards, and we're touching all that. I mean, it goes for even people that are working in an office and aren't necessarily doing direct patient care. I mean, I don't know, maybe you sanitize your space all the time, but oftentimes you may not. So it's important to practice hand hygiene after you leave a room, even if you only touch the equipment. So how do I use hand sanitizer correctly? I know you guys are all very anxious about hearing how to do this. So you want to get a full pump, not a half pump. You need to get a full pump. You need to rub your hands together, and it's not just, I always see people just doing this. It's not just this. And it's gonna take you 20 to 30 seconds if you're doing it right. So you're putting it in. You're rubbing the palms of your hands. You want to get between your fingers. You want to get the tops of both hands all in here. The thumbs get really ignored. And also your fingertips. You should be rubbing your hands like this to really get the tips of your fingertips. So hand washing. Same concept, but you're turning on the sink, getting your hands wet, getting enough soap in your hands. Then you go through the same process. So you're doing all of your hands, fingertips, between everything, all the nooks and crannies. Then rinse your hands off. You can get a towel or turn off the sink with your elbow, or if you're lucky enough to have a sink with a foot pedal. Then not walking out of the room and touching the handle, because even though we're all going to practice great hand hygiene, the person before you probably did not. So you want to use your paper towel to get out of the room that you're in. And this takes longer, 40 to 60 seconds. So these are all the signs that while you're washing your hands, they are everywhere. You can just read that. So are you better than average? It's like I said, our most missed places, the tips of the fingers and our thumbs. We ignore our thumbs a lot. So just be really conscious of that when you're cleaning your hands. You are an important part of infection prevention. It's all of us. There's so much going on in the hospital environment. We're all interacting with each other, and those organisms, again, are everywhere. They're throughout the hospital, no matter how good of a job environmental services is doing. So it's on your watch, your tie, your badge, your sleeve. You got to be aware of all those parts because they get dragged through stuff, and they're no cleaner than anything else. So to wrap up, please wash your hands. So again, we went through the chain of infection, stand-up precautions, the importance of hand hygiene, how to hand rub, and how to hand wash. Infection prevention takes the whole team. So there are consequences if someone on the floor doesn't wash their hands. Do you guys have any questions, comments? Y'all are going to be perfect hand washing people. All right. Well, thank you guys. I appreciate it.